Hello, this is Dr. Kavian Malani with one of the episodes of Virginia Medical Updates. It seems to me that one of the most interesting things that have come out in the past couple of years is some additional technology that's been developed to help with weight loss. So obviously there's an exercise program that people can go under, or dietary restrictions, commercial programs that are very beneficial. On top of that, there are always medications that are very beneficial. Most recently, there are injections that are exceedingly beneficial for weight loss. They're very difficult to manage, and they need to be used by physicians that are extra competent and have been trained in particular, have experience with these medications, given side effect profile and potential issues. But having done all these, the latest technology has really been very beneficial for management of weight issues, abdominal obesity, flank obesity, and basically allowing people to achieve a more sculpted physique, are actually technologies that use laser to burn fat. So there is this technology that's been discussed for some time, and I want to present it right now as a beneficial thing that people can use. In general, the lasers are designed, are particular forms of light wave that do affect a particular area. And people have seen like different forms of laser either in sci-fi movies or actually in, let's say, in scanners, etc. But this particular type of laser at a particular frequency is actually able to burn fat. So the way it works out is that, let's say, for example, that someone has a abdominal or flank obesity of about 5 centimeters or about 2 inches. The laser probes, when placed on the skin in a diffuse manner, do actually destroy about 25% of the fat that they're actually exposed to. So the laser goes without damaging any organ or causing any kind of skin burn or any other inconvenience. It does actually target the fat cells and permanently destroys those fat cells. And then the fat cells do release their fatty content, and basically it enters into the lymphatic system and is drained out of the body in the next 5 or 6 weeks. So this is a very interesting technology, and it's been there for some time. The one that I've used uses a laser form of technology to basically burn fat in a very methodical and rational way. And so there are a number of studies now that show that the abdominal girth, abdominal obesity, is really the cause of hypertension, diabetes, cholesterol, cardiovascular mortality, morbidity. And if one can imagine that a particular laser technology with no invasiveness, that does not probe into the body, go into the body, is not a surgical procedure, you don't have to be anesthetized or knocked out for this thing, it can basically be completely effectively destroying, zapping permanently 24-25% of the body fat. Well, that's a really exciting option for people that want to lose the weight but do not want to expose themselves to any surgical procedures. So this technology that's coming out now is really beneficial. It's been FDA approved and is available in the market. And so I think that that's a really very exciting development for people to actually do this. I did this procedure on one of my nurses a few weeks ago, and basically in the course of 1 week, she lost about 1 inch of abdominal circumference, which I think is very nice and very beneficial. In general, if this trend continues and if these products are used appropriately and by skilled physicians, then basically they could really enhance any other weight loss program significantly and can be really the cause of much benefit. Because if we think that the central obesity, the abdominal girth, is the cause of a lot of problems, then imagine the destruction of these fat cells by a technology that is non-invasive and from the outside of the body could be very, very beneficial. And this is I think the benefit of this particular program, that if it's combined with a weight loss program, it could really benefit the patient and could really destroy these harmful obesity, the fat cells that accumulate and are very metabolically active and are the cause of much misery and really morbidity for the patients. So the technologies that are coming out are exciting, are interesting, and there are two main technologies, and they're both beneficial. The one that I've had experience with is the one that is basically using a laser to destroy fat cells, and I found it in our patient population to be very beneficial and a non-invasive way of managing body sculpting and weight loss. This is Dr. Kavian Melani for Virginia Medical Updates. Thank you.